Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Today I want to talk to you about a topic that a lot of people have brought up to me. A lot of people have wrote to me, emailed me, asking me this question, and that is wondering how can they know 100% sure if they should go ahead with a medical and surgical transition. And the truth is a lot of people don't know, and a lot of people won't get 100% certainty, and that's completely okay, and that's completely normal. And then there's a lot of people who do know for certain within themselves that medical and surgical transition is for them, and then there's a lot of people who not really 100% sure. I want you to realize that it has lesser to do with being 100% sure, because that certainty or lack of certainty has usually more to do with your fears, meaning being afraid of actually fully transitioning, being afraid of getting surgeries and altering your body, and then in the end maybe not looking the way you want to look, or still maybe struggling with passability. So the lack of certainty a lot of times has much more to do with our internal fears than with us questioning our gender identity. Usually, in my experience, when I work with adults, most people deep down inside know their gender identity. So it's lesser about, I'm not sure I'm trans and should I undergo medical and surgical transition, but it's more a matter of, I know I'm trans, but I'm still scared and terrified to undergo this irreversible medical and surgical transition. And that's a little bit of a different matter, but I want you to know this, that a lot of people don't know. For certain, a lot of people just, what they usually do in my experience is that they take little steps. So they start transitioning, and if they feel a lot of uncertainty whether the transition is for them, then they start with non-medical transition, social transition, for example. They'll pick a name, and maybe they'll come out to a few people and see how what the outcome is, and see how they feel about their preferred gender, and then they start expressing themselves in preferred gender and see how that goes. So in other words, we usually take little steps that will ensure for that individual that they are on a right path. So by the time a person gets to surgical transition, they've been on hormones, and they have affirmed for themselves that the changes they have experienced on hormones is in congruence with their internal sense of truth, their internal sense of who they are in regards to their gender. So by the time they get to the surgery, people feel pretty confident that they're doing the right thing. Now, 100% certainty, again, like I said, has less to do with knowing for sure and more to do with our fears. So when we work on our fears, that certainty tends to increase. But it's very incredibly common for a lot of people not to know for sure, because you are stepping into something that is unknown. A lot of times it's terrifying, it's scary, and it's normal not to have that 100% certainty. Somebody actually recently asked me if there is some kind of medical test that they can undertake that will confirm 100% certainty that they're transgender. Well, no, there is, as far as I know, there's no medical test right now. The science hasn't caught up yet. There's also no psychological test I can give you. One thing that I do know is that if you are incredibly uncertain about your gender identity, you're questioning it, but deep down inside you don't think you're transgender or identify as transgender, I do think it's worth your time to spend some time at least working either with gender therapist or working with therapists in trying to ask yourself those questions. Try to understand how much of that has to do with gender expression or gender identity or even your sexuality, because all of those three things overlap. So if you're really feeling a lot of uncertainty, don't jump into medical transition. Don't jump into hormones. You start hormones when you are pretty darn internally confident, or at least have enough of backdrop history to confirm for yourself that you are strongly feeling a very strong incongruence with your biological sex. That's when you start the hormones. And even then, when you start hormones, you evaluate first few months how you feel on hormones and whether they are more in alignment with your sense of self or if they're in a disalignment with who you are. But again, nobody jumps into surgical transitions. And by the time people go into surgical transitions, they have done all of these little steps that have affirmed, I'm hoping that those steps have affirmed for you your sense of self. Now, having surgeries is still going to be scary. Surgeries are a scary process because, anytime we go under anesthesia or anytime we're modifying our body or having any kind of surgery done to us, it is scary, and that's normal. But keep in mind that a lot of people don't feel 100% sure that a surgical transition and medical transition is for them. And it's just a matter of doing these little steps that are affirming. And that's really important to keep that in mind. Again, there are a lot of people who do know, but a lot of people don't, and that's completely normal. Don't chase the certainty. In other words, don't try to get yourself to that place, because then you're going to really delay things for yourself, and you're really going to prolong unnecessary time. So don't try to chase and look for that 100th percentile. Try to chase a sense of inner peace, a sense of congruency, a sense of feeling much more comfortable within your inner identity in relationship to your gender. That's a much more important thing for you to focus on than chasing a particular number, because that can really derail you. So hopefully this is going to be helpful for some of you who are wondering whether you're going to be ever 100% sure. I would love some of you to comment below, especially some of you who have experienced that, not really having 100% certainty and still go ahead with medical transition, and how those little things have affirmed that for you. Comment below. And some of you individuals who are watching this who are not certain and haven't started anything, feel free to comment below, and whether perhaps that's a fear that's really holding you back. Because again, most of the times it's not that you're not sure who you are, because in my experience with adults, again, I'm working with adults, all of them know deep down inside who they are in relationship to their gender. And a lot of times it's just a matter of trusting that inner self. And a lot of times what's keeping people away from transitioning is fears more than lack of certainty. So hopefully this is helpful, and I'll see you guys all next time. Bye.